great to be with you guys today. I'm especially glad to have my new friend, Dr. Daniel Wyman. Is that how you pronounce it? I get it right?
Yes, sir.
That's
Dan
good.
is fine. You bet.
Okay. Well, let me tell you about Dr. Wyman. He is the Chief Operating Officer for Sinensis, which is a global leader in safety outcomes for high-risk organizations. Is that a good way to say it?
Yeah, you bet.
Okay. Um, He has more than 30 years of specialized experience leading large-scale health organizations, operations. In addition to the civilian sector, he served as the command surgeon for the U.S. Air Force Air Combat Command, as well as Special Forces Command, and he retired from the Air Force as a brigadier general. He served in various leadership capacities over the past several years, 30 years, I think,
Yes,
more than
sir.
that, in the military and medical field. So welcome today. Thank you for being with me, Doc.
Thanks, Ken. It's certainly my pleasure to be chatting with you and others.
We were talking last week about some things that might be of interest to folks out there today, and tell us a little bit though about Sinensis before we get into some other stuff.
Yeah, Ken, thanks. Happy to. So, Sinensis is an organization founded about 15 years ago by our CEO and leader, Steve Powell. Steve started life as a naval aviator, was very much into aviation safety. He was in the time naval aviation where aviation itself was really looking forward uh, in safety, along the lines of safety, and implemented operational risk management, crew resource management, really revolutionized the cockpit and safety within the aviation community. And then he left the Navy, joined commercial airlines, served in the same role as a pilot and a safety specialist, and then transitioned into healthcare. And I got to know him back then, probably 10 years ago, when Sinensis had an Air Force contract to support patient safety within the Air Force. And I worked with him and his organization quite a bit back then. And, and they integrated this new program called Team Steps, which is basically crew resource management and operational risk management within healthcare. It takes a lot of those same principles from aviation into healthcare, and then helped us to expand on our high reliability within the Air Force to become a high reliability organization within Air Force healthcare. And so got to know him and Sinensis back then. And since then, Sinensis has kind of expanded. Steve has gotten back to his roots. So now, not just to healthcare safety, but back into aviation safety. So we work with the Air Force in one of their program called LOSA, Line Operation Safety Audits or Assessments. We're helping to manage those with them, going into operational environment and looking at threats, errors, and undesired states, and we're in the process of transitioning that actually back into healthcare. So we think we're in a unique place with our expertise in aviation and in healthcare to kind of take the lessons learned from each and kind of go back and forth to make these essentially high risk organizations safer every day. And so we work with civilian partners and federal healthcare partners, recently part of a team that won a big contract with the VA to help with the VA health um, and as they respond to COVID and other emerging threats in their environment to ensure safety, not only for the patients and their families, but the staff too. I think that's as we look at COVID, we will see the face of healthcare. I mean, the face of the world, but our economy, but in particular, healthcare change, and we're kind of trying to absorb those lessons learned and help lead that change within many of the organizations that we work with.
What do you see as being a major? I know we're in a huge paradigm shift now. What do you see going forward is going to be the major change?
Well, I don't know that I would say there's one major change, but the face of healthcare truly has changed. Some of it's been driven by the COVID patients and the requirement to basically handle those and I don't want to say set aside, but a lot of the routine care that normally goes on in hospitals has been foregone or decreased because we're dealing with this onslaught, this surge of COVID patients, and that's across all of healthcare, whether it's outpatient healthcare, acute care in a hospital, ICU, post-acute care, skilled nursing, home health, and even people managing their health within their own home. And so, to me, the face of healthcare is going to change. We've seen a big, like with everybody, like we're doing now here. Maybe 8 months ago we would have done this meeting, in one place where we're both sitting together. Now everything's virtual. There was an aspect to virtual healthcare, telemedicine, whether that was radiology or radiology was one of the big ones that did a lot of telemedicine beforehand, and maybe other outpatient like psychiatry, some telehealth psychiatry. But I think we will see an explosion of telehealth, telecapability. And then as I was saying earlier, with patient safety or with healthcare safety, I think we need to look again, not only with patients and their families, but with the staff within the facilities. I was reading an article just the other day about the people in the trenches, on the front lines, the doctors, the nurses, the technicians. Some of the disease and even death that we're experiencing with our healthcare providers is significant, and I think we need to that approach to healthcare will need to change. I think early on we started with some surveillance of our patients. Now, then surveilling our staff. I think that will continue into the future as we get through this COVID issue. It's kind of like what's next. To some point, I think the world may have, if you will, dodged a bullet with some of the previous ones, whether they were SARS or H1N1 or MERS, or it was maybe somewhat fortuitous that they didn't become more worldwide and more pandemic in nature like COVID has become. So is this, I don't want to scare everybody, but is this a potential for a new normal? Or will there be seasons of heightened infectious disease?
Right.
And we need to be prepared for that.
Well, one of the things that you and I had talked about last week when we were talking about getting together is the ripple effect of what is happening. And I know that, we're just now discussing how that's going to change the face of practice of what we do. But the other side of that ripple effect is the emotional, especially for the caregivers, the doctors, the nurses, even people that they're not engaging the patient, but they are there in that setting. Maybe they're just there to deliver the food, or they're there to clean the rooms, or they don't engage with the patient, but they're in that position where they're near them, and the stress level. So from an emotional standpoint, what can we say to those who are in that position that might be a possible way for them to increase their resilience so that they can continue to do their job?
No, great thoughts and great questions, and I think the key is in that terminology, resilience. I think every physician that goes through medical school and residency, every nurse, my son is a nurse, every nurse that goes through training, every technician, everybody, as you said, whether they're housekeeping, food deliverers, administrators, lab, radiology, anybody in the healthcare environment, as they go through the training, I think at some point they come to the realization that by raising their hand and their calling, their chosen profession, that they're making some sacrifice. When you go into medical school, they talk about physicians have a higher than normal expectancy for drug and alcohol abuse, higher than normal expectancy for maybe something like social events like divorce rates, suicide rates, those type of things. And now this issue, COVID, has brought that to the forefront. As we've seen so many healthcare professionals or healthcare, raising their hand, going to the front line to help fight this disease, to help be with the patients, and exposing themselves to considerable risk, particularly during a time where personal protective equipment, PPE, is now becoming scarcer, and we're learning how to reuse PPE or those type of things. So there's that stressor. I think somewhere down the line, we all come to the realization that we've exposed ourselves to that. With COVID, with other infectious diseases, the issue is how then does that affect the rest of your life, your family, your extended family, your friends? Are you bringing in these cases, are you bringing COVID home? If you spend the day in an ICU or an ER working with COVID patients all day long, you can decontaminate as best you can, but there's always the back of my mind, am I bringing my this infectious disease? So I think, and as you certainly know and understand, resilience is that key, and big and foremost in that is education. What is the truth? What is reality? What is possibility? And what is probably worst case scenario and not a probability? So educating everybody. Where are we in our community with COVID? Is it within our community? Is it endemic in our community, or is our community one that maybe doesn't have so much? So what's my risk? What are we doing to combat that? Wearing the face masks, the face shields, the full gowns, and taking appropriate actions like that. And so all of that, it involves education. Part of that is surveillance. I'm surveilling my symptoms. We were both commenting earlier about a little bit of a cough. This is allergy season here in Atlanta, and the yellow pollen is prolific. So not every cough is a COVID cough. So how do we understand and educate our folks like that? And then there need to be outlets. And there need to be some place where they can raise their hand and say, I need a timeout. I've been doing this 5 days straight. I need a timeout, or some resource to talk to. I'm feeling stressed about this. And so people like you come into play there, where people to help them to deal with their stress, to quantify that stress, to qualify that stress, and to provide those opportunities for stress relief and debrief.
Right. I like the word timeout. I was speaking with one of our local hospitals recently about the possibility of assisting them, not unlike what we do with law enforcement when we do a critical incident debrief when there's been a tragic event. There was a tragic event just this past 3 days ago. My oldest son had a friend who was on his honor guard with the U.S. Air Force, and he was a policeman with the Smyrna Police Department. He was killed in an accident the other day. You might have heard about that. We do critical incident debriefs with law enforcement, and so we're talking with the local hospital about having a similar type opportunity for the staff, the doctors, nurses, anybody that feels like they're stressed out, just to have that time out so that they can debrief in a safe environment where they're not going to be judged because they're taking off their Superman cloak and being real human beings. And
Right.
That's another question, because I did my clinical work in the hospital years ago, and we have sometimes we have this mindset that we can save everybody.
Right.
And I know that's one of the concerns that you guys have as far as addressing safety, is the idea that we can help make the place a stronger, safer environment for people. But how do we get to the point as human beings where we are able to come to peace with the reality that we can't save everybody?
Yeah, no, those are great questions, and I think intellectually we can understand that that I don't have the resources. I'm as you said, not Superman. I can't save everybody, um, but heart wise, again, most of us came to healthcare as a calling, as a profession. It's not a job. It's not a job. It's not someplace. It truly is a calling and a profession, and it is that how am I able to cope with I couldn't save somebody, or I couldn't change their quality of life, and in this environment, in the COVID environment, that's happening daily. What some of the cases we're seeing, relatively healthy people, kind of sick one day and 2 days later in the ICU, and deceased shortly thereafter, and it's somewhat mind-boggling for healthcare professionals to understand it at an intellectual level. Again, you can, and I think everybody deals with that in different ways. I started life as a family physician, and then kind of transitioned to public health and preventive medicine, and there was a part of that. I can't save everybody, and certainly not one patient at a time. How do I do this across the spectrum? So again, as we talked earlier, I think it's that ability for them to call a timeout, and certainly there needs to be some expert in resiliency and critical incident stress debriefing and that type of thing, but they also need to be with peers so that they can hear it. Um, Everybody is constantly thinking, I'm the only one that feels like this. I'm the only one, and the truth is no, almost everybody is feeling like that. That not insecurity, or that I let my team down. I let this patient and their family down, and there needs to be some coming together of staff. Sometimes doctors with doctors, nurses with nurses, so that they can share those experiences. And many times I've found that engaging the family members is very important in that environment. There have been more than a couple of times where a family, I've felt very, very uh, you know uh, sad, or I don't know, the sense of loss, and a family
Mhm.
member would come to me and say, we really appreciate what you did for Dad, and we knew, his time on this on Earth was not infinite, and but you made those last weeks, or you supported, and you were very open, and sometimes it's the family members that
Mhm.
that can help the healthcare professionals the most.
Wow. Um, I was doing a class yesterday online, the first one we've ever done online. We've trained 17,000 people, and it's always been face to
Wow.
face. But
Yeah.
we realized that the paradigm is changing, and we're going to have a new platform for getting the word out and educating, as you said. I've always appreciated Sinensis because you guys have been a sustaining partner in our work at Armed Forces Mission, and Steve was on our board of directors for several years and continues to be a strong partner with us, and we appreciate that. But I was speaking with a veteran back in the last summer, a year ago, and he shared with me, he said, I swore I would never tell anybody again if I was suicidal. And the reason being, he was sitting in his doctor's office as a new doctor. His former doctor had retired, and this new doctor is doing the 21 questions,
Yeah.
and it's how are you sleeping? Check. Well, I don't sleep really good. How are you eating? He said, check. When the wife cooks, I eat.
Right.
And then he said, have you ever had thoughts of suicide? And he said, oh yeah. And the doctor was almost taken back. He said, you've had thoughts of suicide? And he said, yeah. And he said, do you have a plan? And he said, oh yeah, I'm a veteran. I've got an easy plan. And he didn't even finish the questionnaire. He said, I'll be right back. He looked at his watch, like, where's he at? 10 minutes went by. And then 10 minutes later, the doctor walked back in the office with 2 police officers who said, sir, you're coming with us.
Yeah.
And he said, I'm not going. He said a few expletives. He said, I'm not going anywhere. He said, yes, sir, you're coming with us. And they put him in handcuffs.
Wow.
And took him to the emergency room. That's not a one-time event. I hear that over and over. I was talking with someone just this week that just at the start, the outstart of the pandemic, someone had called for a health and welfare check on her who was in another state because they were concerned about her. And the police showed up and handcuffed her and took her to the emergency room. And I work both sides of the fence. I work with law enforcement. I carry a shield with my local police department. And I understand that there are times when we do have to handcuff, and that's because of safety issues.
Right.
But going back to this veteran, for example, he was in the doctor's office.
Right.
He didn't have a weapon in his hand. He had not taken any pills. He had not drank, chased it down with a bottle of Jack. He was in a safe environment.
Right.
And then he was immediately taken out of a safe environment in handcuffs. And that's a little disturbing, and so we talk a lot of times in the circles that I run in with people who are having suicidal ideation about the system. And one of the words that they often say is the system's broken.
Right.
And in many ways, I have to concur that it is. I don't want to put you on the spot, but what do you see as a major area of concern, whether it's suicide or safety or within this context that we're talking about? What is a major area that maybe we might not want to say it's broken, but it needs a good adjustment?
Yeah, I mean, your example is a sad example, and I think you, along with I and many others, you know, they understand the intentions are appropriate, and sometimes when you develop a system, the system itself takes over. So you mentioned earlier about the thousands of education. I think it truly is about education. In your scenario, the veteran was seeing a new physician. Obviously, that patient physician relationship hadn't been developed, and unfortunately, that physician felt led because of some of the system issues and requirements about reporting and all of that, led to do that. I think in a very same situation with a better patient physician relationship, maybe that would have gone much differently. Probably, I've had a couple of those type of situations. Well, let me build on that. What do you have a plan? What is that in plan? Are you actively suicidal now? What where are you on that scale? Where are you today with that? What are their triggers? And then what resources have you used?
There you go. Yeah.
Who have you reached out to? And there may have been every time this happens, I reach out to my psychiatrist or the social worker, or I come to you, my previous doc, and we work through it. So I think there are a number of assets out there for everybody to use. I think sometimes it's that education piece. And I went to a medical school that was firmly grounded in family medicine and psychiatry. A lot of our leadership came from there, and so we explored this within ourselves. And frequently when somebody says they're suicidal, that brings out emotions in ourselves. Well, how do I react to this? Wow, somebody actually said it. They told me in medical school I would have days like this, and now somebody actually said it. What do I do? And we, with all the good intentions, we've developed rules and requirements that require physicians to report these type of things, and require as you said, the law enforcement, when they get involved, to put people in handcuffs, and because they don't know the situation. And it's it's more of an education issue so that we all become a little bit more comfortable with that, and that we have those. Maybe I'm not so comfortable with somebody who says they're suicidal, or but I know that I have a resource right down the hall or a quick phone call that I can get them in, and this is their specialty. They, call Ken, and
Mhm.
he'll deal with it. So I don't know that anything is hard broken. I think that just, there's levels of comfort that a lot of people, and obviously you have a tremendous level of comfort. There was a time, and I think you probably can remember back, we really questioned whether it was appropriate for a physician to ask that question, because,
Right,
oh well, they may not have been suicidal, but you just planted that. Well, if my
right,
doctor asked me if I'm suicidal, maybe I should be suicidal.
right,
you know Now, that I think that bubble in the system got dealt with pretty quickly. Come on, no, you're
right,
not going to make them suicidal by asking them.
right,
But also, when you ask that question, be prepared for a "yes, I am" response. And some training programs, some professional development programs kind of walk it through, just like you said. There's this checklist, and if they, my expectation is they're going to mark no in all the checklist items, and don't really address when somebody says, "Yes, doc, I am suicidal," or
right,
"I was suicidal last
right,
week,"
right,
and then how to deal with that.
right. That's very, very good. Well, that's a tough subject, I know, and probably 99% of the people will never ask the question because of
Right,
what you just said. They're afraid they're going to put that thought in people's head, and we have addressed that, and I think we've pretty much surmised that that is one of the biggest myths out there.
right, right.
Um, but in closing, I want to ask you a different question today. I want to ask you, looking back on your 30 plus years in the profession, and as a military officer, uh, making it all the way to the position of brigadier, I want to close on a positive note.
Sure.
That's always important. We talk about tough issues, but we got to cling to the good. And so, looking back over your career, what stands out to you as something that just flipped your heart upside down in a positive way?
I, I could probably give you a handful, or more than a handful, of specific events, but I'm really, when we do the leadership dynamics and all that, I'm very much a team-based person, a team leader, a cheerleader, a very inclusive type of leader, and each and every one of the opportunities, those things that, like you said, bring a smile to my face, was when a challenge was a challenge existed, whether it was when I was at a big hospital on the Gulf Coast shortly after Katrina, rebuilding, and we had some challenges rebuilding and patient safety in those, or challenges in Central Command deployed environment, presenting that challenge. And I had always had a vision, and I'm a relatively smart guy, and I'm climbing the ladder, and I seem to be doing good. I've got this idea of where we should go, but I always found when I presented the challenge out there, and to the team, to the bigger team, with and explain the resources and the the limitations, invariably the team came up with a better solution than I ever thought could happen.
Hmm.
So I would turn this around, that as we grow new leaders, and you're dealing with them every day, and I am too, in our different professions, you know be a leader, trust your team, and challenge your team.
Hmm.
um, Sometimes your solution is the best solution, and you all arrive at that solution, but not infrequently, other people, young airmen, young technicians, young doctors, nurses, come up with solutions that didn't even dream of, that far surpass, where, I put this challenge out, to be at the 50-yard line, by, in 4 plays, and they got us to the goal line in 3 plays.
Right.
I didn't even dream of that. I could recall multiple times, and that, that again, that's my life. But the the people, and we're seeing the same thing now, with this pandemic. The work that people are doing is 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 revolutionary. We
Mhm.
never, like you said, the distance learning or virtual learning, that people thought we can never do this in our company. They've invented new ways of doing that. We had, again, people on the front line are reevaluating how we screen patients and how we handle patients in this environment. Tough times call for tough measures, but
Wow.
usually in these kind of circumstances, I am I'm no longer surprised, but somewhat expecting these people to step up and just do fantastic things.
Wow.
And I think we see that daily.
Absolutely. I appreciate that you spoke about airmen. You don't know my whole story, but it was actually my 19-year-old airman son that saved my life back a little over 10 years ago. And that's the reason that I do what I do today.
Wow.
And the interesting thing about that is Air Force came through for Army that day. I was at down at Charleston Air Force Base, and we were down there doing dignified transfer exercises. We weren't um, there permanently. We're just there for the morning as the planes come in, and you've seen that before, and the caskets roll off the back of the airplane, and so it's an emotionally tough morning. Uh,
Right.
and so we had a little bit of R&R that afternoon. I was touring the Yorktown. My
Oh,
son had just gotten stationed at Charleston, hadn't seen him in 6 or 7 months. And I said, come over and tour the Yorktown with me. We were walking around the Yorktown, and he said, Dad, you're not working out anymore. And he knew that was important. And so he was asking some leading questions there that
right. Right.
uh, building some rapport with his dad to ask the
Yeah.
question that he knew he needed to ask. And he knew I'd been through some tough times with his brother, my third son, who had been life flighted to Grady after he'd been burned. And that was very traumatic for me. It happened on my watch, and I felt responsible. And the bills came in, and that was during the economic crisis of '08 and '09. And
Wow.
we were without insurance at the time. The life flight alone was $22,000, and the medical bills started to ramp up, and I couldn't pay it. But I did have a life insurance policy. And I knew that my family would be better off without me. That's what I thought.
Yes.
And so he pulled me over to the side, and here we were. He was in his Air Force uniform. I was in my Army BDUs at the time. And he said, Dad, are you thinking of suicide? But the reason he asked that, 19 years old, most 19-year-olds would never ask that. They wouldn't know they're supposed to.
Right.
The reason he asked that was because the Air Force had trained him in suicide intervention.
Right.
And the Air Force is, just as all the branches have a strong component that trains their personnel in asking that question. He asked the question.
Right.
And we talked for a few more minutes, and then the first sergeant called and said, we got to get back on the bus and head back to Fort Jackson. But the next morning, I was getting ready for PT, and I heard a knock at the door. And I thought it was the first sergeant coming. I was the old guy in the unit, and they called me the old man. And I was getting ready for PT. It was my Air Force son, and he had gotten permission from his flight leader to leave Charleston at 4 o'clock in the morning to be at Jackson at 0600. And here he was running PT with the U.S. Army, stayed by my side the whole day. And then that evening, after the duty day was over, he said, Dad, get your gym clothes on. We're going back to the gym.
Yeah.
So he helped me get through that very difficult time. And so even though I'm Army and we like to, jab each other every.
Right.
I've got one
Right.
that was Coast Guard, one that two sons now in the Air Force, and Air Force came through for Army that day and came through for me personally, and it's because of education.
Yep.
And I appreciate what you guys are doing at Sinensis. You guys are near and dear to me. You're sustaining partners in what we do. And I just appreciate so much your willingness to spend time with us today. So thank you,
Thanks.
Doc.
Well,
Thank you.
thanks, and thanks for sharing. At the end of the day, it's one team, one fight. And
That's it.
that team right now is USA and the world.
That's it.
We're all in this together. Yeah.
It's just like that hashtag going around. We're in this together, and I appreciate you
Yeah.
saying that. So, Doc, thank you
Thank
so
you.
much for being with me
Thanks,
today.
man.
I hope that you that watch this today will find something that you can use that hopefully will build your resilience. Thank you again, Doc.
Thanks. Take care. Bye.